Good morning, everybody. Thank you all for joining us today in the morning meeting, our Thursday morning meeting. We'll get started here in a second. I am going to change my background because uh, it is not that nice, at least in Ohio. Alrighty. Alrighty. Thank you all again for joining us today. My name is Jacob Oates, first and foremost. I am with Groundwork Ohio. I'm the Director of Programming and Impact here. And I will be hosting the morning meeting today and look forward to convening with you all and introducing our guest speaker today. First, before we start, I'm going to give us a quick update about where we're at um, in Ohio. And for starters, the General Assembly, the Senate canceled committee hearings this week due to weather. The House may start committee meetings next week, and we're waiting for notices to begin coming out tomorrow at the earliest. It is anticipated that legislative activity um, uh, before the May 5th primary will be continuing to be slow. But on the congressional front, um, in Congress, appropriation negotiations continue. The House passed funding very in line with the Senate spending plan to support babies and toddlers, including Head Start, childcare, heating, and more. The Senate is now debating funding levels for Homeland Security and may vote today. If spending plans are not approved by tomorrow at midnight, we face another federal shutdown. Um, if you have any questions about this, please feel free to reach out to our team um, there. Additionally, we do have federal Head Start grantees in Ohio, so we are watching Congress closely for those. That's all for our updates from the policy side. I'm going to go ahead and dive into our guest today. Chara Fisher Jackson is an advocate for children's education and equity, appointed as the executive director and CEO of Cincinnati Preschool Promise in 2019. Chara's leadership journey began after a successful term as interim president and CEO of the Urban League of Southwestern Ohio. Her commitment to children, youth, and parental engagement and education shines through her work. Her vision for Cincinnati Preschool Promise focuses on high quality preschool access, ensuring children are well prepared for school. Since taking the helm, Chara's impact has been evident with Cincinnati Preschool Promise tuition assisted children showing stronger kindergarten readiness. So, all that being said, I will pass it over to you, Chara. Thank you so much for being here and for um, joining us today.
Thank you so much. I appreciate it. It is so good to see some familiar faces and new faces. And I just want to kind of give you an overview and a splash of the Cincinnati Preschool Promise. And hopefully it'll be a bright spot in your morning of how communities can come together and how their commitment to early education can make a difference. So if you flip to the first slide, you will see how we keep the promises and the core of what we do at the Cincinnati Preschool Promise. It is offering tuition assistance for preschoolers who are 3 and 4 years old for families who could not otherwise afford it. 90% of our families say they would not be able to afford early education but for the Preschool Promise. Increasing the number of quality preschool seats in Cincinnati. When the Preschool Promise was started in 2016, we had what is known very commonly as quality gap neighborhoods, where there were clearly not enough high quality pre-seats for all of the children that we had. Less than 50%. If every child showed up and wanted to go to a preschool, that opportunity was not available to them, and specifically not available in their neighborhood. And it is partnering with community preschools to improve quality. We are very closely aligned with the state's QRIS system and Step Up to Quality, and ask that all of our providers strive or be at the highest quality ratings, which used to be 3, 4, and 5 on our STAR system, which we now consider silver and gold. Those providers are then eligible to receive tuition assistance on behalf of families. And finally, supporting, recruiting, and retaining and wage parity for early childhood educators in the workforce. When we started, our goal was $15 an hour back in 2016. We have amended that to be very clear that it is a living wage and wage parity so that there is equitable, fair, and reasonable pay for early childhood educators. Give you a little bit of a history on the next slide. As I said, we started in 2016 with the passage of a levy in partnership with Cincinnati Public Schools. That levy commits $48 million for CPS, of which $15 million is dedicated to preschool expansion. Originally in 2016, passed, renewed in 2020, renewed again last year in 2025. This time the renewal was for 10 years rather than 5 years. We feel very fortunate, one, that we renewed in 2020 in the middle of a pandemic. I can't tell you what campaigning is like during that time. And again, in 2025, when it was challenging, again and again, our community has said we are willing to make the investment in early childhood education, and the outcomes demonstrate to us that it is worth the investment. It came about and the levy was passed and the funding was dedicated through strategic partnerships, not only with our public school system, our faith-based community, our early educators, our families. Everyone came together to make sure that this could happen with almost a 70% approval rate at the ballot. When we were started in 2016 with that first levy dollar, there was no preschool promise. There was a reference to something called the Preschool Expansion Organization. Nothing. And it had to be built from scratch. And I only say this to say, if your community is ready and willing to make that investment, don't feel like you need to have a clearly defined plan, strategy, all your I's dotted and your T's crossed. You need the will to make that investment, and then there will be a roadmap that will come forth. The structure that was developed is that we are a nonprofit organization with a sole corporate member, which is the United Way of Greater Cincinnati. We have an 18-member board, of which 3 organizations appoint or send members to us for ratification. And just last year, we changed our structure so that we can also select some of our board members. We serve only families who live within the Cincinnati Public School format, footprint, and only partner with preschools that are also within that Cincinnati Public School footprint. That is not necessarily by choice. We would love to serve all of Cincinnati and all of Hamilton County. Those are the rules for proper public funding and the rules that the state auditor has set out and the rules that we've agreed to through contract with Cincinnati Public School. We have 4 standing board committees on our governing committee. We also have ambassadors and provider council. So again, this is governed for us by a contractual agreement with Cincinnati Public Schools. At one time, that was a 23-page agreement. Through some careful negotiations as we matured as an organization, as we became more trusted, not only with the public funds, but by our partners, our families, our providers, and our educators, that agreement has been scaled down to have the bare minimum of how we should operate and giving us some flexibility to do what we know is best for the community. In many ways, as a nonprofit organization, we can move much more quickly than a larger organization like Cincinnati Public Schools or our local job and family services. So on the next slide, you will see kind of our snapshot of what we've been able to accomplish in the onset. And there's a much bigger and prettier picture of this on our website. I would encourage everybody to take a look at that, and I will put it in the chat. But what we've seen is that investment in early education, by making sure that children are able to attend a high quality preschool, has made the difference in them showing up in kindergarten ready to learn. 63 to 78% of our preschoolers who attend a high quality preschool do show up ready to learn. We are very proud to say that in our time, more than 13,000 children, and now it looks a little bit more like 15,000 children, have been able to have an opportunity for early education. We've had continual growth of the number of quality preschool sites in our community. We started at around 24. Now our community provider network is more than 230, and we are recruiting every day. While I say we'd like to have everybody in our network, it's optional. People have to opt in to comply with our rules to be our partners. I think we have about 34 high quality partners who haven't joined us, and every day because we have goals and ambition. We hope to get those other 34 in the fold to join with us to make sure that families have every opportunity. I will also point out that we've supported more than 379 educators with grants over our time. We have what's called a teacher promise grant and a staff support fund, where we offer grants up to $4,000 to $5,000 to encourage teachers to stay at their site, to supplement what their wages are, and continue in the profession as early childhood educators. Our staff support funds are not given to individual teachers, but given to preschool sites so that they can use those for recruitment, for retention, for salary bonuses, for benefits, all of the things that they need to make the profession more attractive and to stabilize their preschool site. We also see in sustaining quality, and you'll see that donut graph in the blue, the majority of our funds are always, always, always dedicated to tuition assistance, because that is the promise that we made to the public to make sure that our families and children have access. And we are proud to say that we run a tight ship. We have a staff of 7 full-time and 1 part-time, and our overhead never goes above 75. Our main dedicated $2 program is usually 75% of our budget. We never exceed 25%, if that much, in overhead. So you hear a lot of talk about the efficiency of nonprofits and how we work. We're very proud of that. On the next slide, what you will also see is that each year we do an external evaluation that is done by Innovations in Community Research that is housed at Children's Hospital that really tells us how we're doing. So this is a snapshot of what we did last year, where we had 1,090 preschoolers receive tuition assistance. We had 208 providers in our network that were doing quality and high quality seats. We had 13 providers who were able to move through our coaching cohort to reach a silver and gold step up to quality rating because of the work that they put in their dedication. On the next slide, you'll also see some of our direct impact and outcomes related to children. We like to say that looking at the KRA scores for those that receive tuition assistance, being in a preschool promise, high quality preschool, makes it 33.1% more likely that you'll be on track for demonstrating readiness, and that you'll be 62.9% more likely to be on track for language and literacy. Those are statistically significant numbers that we know without that investment, our children wouldn't get the strong foundation that we need, and we're really proud of that. We're continuing to track how those students are doing in 1st grade through 3rd grade. Some changes in our testing mechanisms in our system have made that challenging, but we are committed to seeing not only do they show up to kindergarten ready to learn, but are they on track in 3rd grade reading. Through our initial time, when we went back for renewal for the 2nd levy in 2020, we had a longitudinal study from 2019 that showed us students who showed up to kindergarten ready, which I'm sure will be no surprise to all of you, graduated on time more frequently, did better in attaining post-high school K through 12 credits, attainment, job security, scored better on the ACT. All of their markers were much better when they showed up to kindergarten ready. We are very careful to also say that is not only dictated by a KRA score, but we also look at the progress that is made by different assessments during their preschool experience, so that we're careful to measure social emotional learning, how well they're doing, all of the things that we know matter, just not a simple test like the KRA are. On the next slide, you will also see how we are part of a larger cohort across the country. We used to say that we were one of 52, but now we're one of 57 local initiatives across the country where voters have said we are dedicating this dollar for early education. We are one member of the K-Ready Alliance here in Ohio, which are local preschool initiatives. And I see Dr. John Jones on the line as well. And he is doing that work in Toledo. The Children's Funding Project and the Children's Funding Accelerator are great partners to us and are always willing to be partners to any community who said, we want to try this out. We want to understand how this works. They have an A to Z roadmap that says, if you're interested in having dedicated funding, not only for preschool and early education, even infant toddler, even after school, any children's initiative that needs dedicated funding support in your community, they stand ready to help and support. On the last slide, see what our last slide is. It's really the strategic questions that we think about looking forward. We are in the process now, even in this dynamic, uncertain climate, of building on our next strategic plan. Our commitment and the promise that we make is an equitable lens that focuses on accessibility, affordability, and availability. So these are the questions that we are grappling with, is how we create a cohesive early education environment, knowing that we're limited to preschool, and really that 0 to 8 space is what needs the most support. How we keep our stakeholders informed and leverage our momentum from change and support organizations like Groundwork Ohio that are public policy and advocacy focused and leading the way. We're also proud to partner with organizations like the Ohio Organizing Collaborative, the CEO Project, and the Black Child Development Institute Ohio, who carry that policy banner where we can't as a nonprofit organization. Our public policy is to keep our network informed and energized while we partner with other organizations to lead that charge. We also look at how we can implement policies and practices that eliminate those unnecessarily administrative hurdles and the other things that don't need to be there and stand in the way of implementation and delivery of an early education environment that is fair and equitable and productive. As a nonprofit organization and an entity, we have the flexibility to do that. And then we also talk about data collection and analysis. We will be doing a very small survey this year that we're happy to share because we have to with our strategic plan. But we are in a position now where we start to think, how much more data can we afford? And how much more data do we need to tell us that parents and families need affordable early education opportunities in their communities, and teachers need to be compensated fairly and equitably to continue in the profession. No matter what survey we get, it's going to tell us the same answer. So we are much more interested in investing our dollar in strategies and innovation and how we implement that, and relying on our partners who do that at the macro level to share that data and consistency in moving forward. So that is our snapshot of what we're doing with the Cincinnati Preschool Promise. I see some questions in the chat, and I will run down. One is it a partnership with the school system? It is. The Cincinnati Preschool Promise is funded through a Cincinnati public school levy. We split the funds and we negotiate each year how we split those funds, but we operate completely separately. Cincinnati Public Schools does have Cincinnati Preschool Promise funding. Their funding is limited to only doing tuition assistance, while we use our funding for tuition assistance, quality improvement and coaching, as well as teacher and educator support and grants. Next question, the biggest obstacles when we face getting this up and running. Public trust and a roadmap of how we should do it, right? Lots of negotiators had to come to the table, and not everybody got what they wanted when we left that table and stood up. I am the fourth executive director in 3 years, and it was been a careful balance of saying, how do we keep the promises that we made, recognize the changes and needs of the community, while keeping within the bounds of proper public purpose. We had a roadmap of what was needed. We didn't have a roadmap of how it should be done in our community. That requires a lot of negotiation, a lot of, in the old Aaron Brockovich way of eating pound cake in the church basement, of going into communities and really understanding what the need is and having some flexibility to change. And so I think we base ourselves on our core values of continuous collaboration, a commitment to innovation, and a commitment to transparency. I see a couple of my team members on the line as well. We pride ourselves on saying we do the best we can, we acknowledge when we're wrong, we correct mistakes, and we do all that in a way that is collaborative with the community, not for the community, but with the community. Someone asked, is this center-based? We also work with family childcare homes. We absolutely have the lens of equity where we work with parochial schools, single site centers, multi-site centers, and family childcare programs. At one point, the percentage of our providers that were home-based family childcare programs was about 75%. So the majority of our network, not the majority of our seats, but when we count the number of partners, we're home-based family childcare providers. That is part of our commitment to equity. And in many times, our rules and policies and compliance is implemented in a way that recognizes equity means it can't be the same for everyone, that policies and implementation have to be adjusted to recognize the realities and the difference. If you are a multi-site center, if you're a nonprofit center, if you're a for-profit center, if you are a family-based, if you are a type A or a type B, we take all of that into consideration for how we implement our policies and practices, because that is the commitment that we made as an organization.
Another question in the chat, Chara, is from Todd. What literacy partners do you work with?
So many. We work with, of course, Imagination Library. We, of course, work with Queen City Book Bank. We have done learning through art and individual programs as well. We try to make available to our provider network the literacy partners that they choose and try to fund that for pilot programs. We've also worked with the Literacy Lab and Leading Men Fellowship. So it really is unique to what the literacy partners are that a provider or a preschool site may like, but also they use evidence-based curriculum and always have in implementation in their lessons plans as is required and recommended in the Step Up to Quality scheme. So we're always proud that our literacy rates are there, but also we occasionally run what's known as a pitch night. And our pitch night is really a desire to drive and bring innovative ideas that say to us, if there are new literacy partners out there, we do it kind of like a Shark Tank and say, let us know what it is, present to us what it is. We do a public voting and a provider, and then we will fund that pilot project for that new partner to see how it's going to work. These are opportunities that otherwise would not be available to smaller providers or providers, as we know, that have lean margins and are really focusing on the basics because that is what their budget allows.
Another question, what's the first step to be involved, and is this available in Northern Ohio, specifically Cleveland?
We do have a partner, Pre4Cle, that does investments there in Universal Pre-K with UPK as well. And I see Joy tapping in. She is the best resource for that. We do have members of the K-Ready Alliance there. I would say reach out locally to those partners because they can tell you how it's working there, what public funding has been invested, and the opportunities that lie as well. I would recommend that everybody start local and build up from there. And if you visit, I'm not sure we have a K-Ready Alliance website or a platform yet, but I'm sure that Joy can follow up and provide some more information. I'm putting you on the spot, Joy, because we're friends like that. Someone asked us when pitch night is. Pitch night for us this year will probably be at the beginning of the second quarter. So we'll probably kick that off in April. It's a little touchy because that's also re-enrollment time. So my team is like, too much, too many things. But we definitely want to make sure that we get those funds out before the end of the fiscal year. Our primary targets for pitch night this year will likely be a transportation pilot. We do have some funds to kick off to see how that would work, and something on mental health and emotional support for our educators.
Another question I see here, specifically, let's see, this guest was wondering if you collaborate with training organizations to bring Ohio approved trauma competent training content to your early childhood education partners, and then if yes, who could they reach out to for a follow-up?
Absolutely. So 2 places that we can reach out to a follow-up. I see on the line is Brittany Pina, who is our Director of Quality Education, who helps us develop, design, and recruit partners for our PD opportunities and other training for our educators and site. We try not to do that, but rely on people who have expertise to that and build those partnerships. I also see Kim Ginn, who's from 4C for Children, who is our other strong partner that says, go to who the experts are who do that training, partner with them and make it available. Those are 2 people that I would recommend. You can see Brittany's contact information in the chat or on our website. And I know that Kim and 4C are also ever present on the website and Facebook to reach out to them to see what those PD opportunity and training opportunities are that are available.
Thank you so much.
Yeah, the advantage is having someone like Preschool Promise often allows us to make it free. and no cost. So that's the plus. And I will say, as it's opportunity, I know that not everybody wants to come to Cincinnati, but as we have extra seats and available, we always make those open. So you may want to check on our Facebook page and follow us as well, because it doesn't cost us any extra to allow other people to sit in those seats when they're available and we're at max capacity, particularly if it's a virtual opportunity. So always reach out, because we would rather have everyone have an opportunity once we've incurred those fees and paid for it. And they're Okra approved. Should mention that too.
It looks like those that you mentioned have put their contact information in the chat. So if you find your way there, and you can reach out to them for more information. We do have a couple more minutes for our morning meeting. If anyone else has any more questions, feel free to come off mute or continue to throw them in the chat. We'll continue to monitor that, but
I have a quick question, if you don't mind me jumping in, Jacob. Chara, thank you so much for this overview. I know you guys are doing so much great work, and it's a lot to squeeze into a short time, and you've done a great job really highlighting and exemplifying the great things that you're all doing. So thank you so much. And I'm just wondering if there's anything that you would highlight or underline with regards to any of the crossover work that you're all doing related to health and well-being, or even young child mental health, or anything that you haven't touched on there that you would want our audience to be aware of?
I think we were very intentional, almost, coming out of the pandemic almost 3 or 4 years ago, to focus on that social emotional learning and mental health people for educators as well as children. So we try our best to be responsive to what providers say they need and what they're recognizing as the experts in the field. Because as I say to people, like, we don't expel preschoolers. We find interventions and strategies, but we don't expel preschoolers. So we have been very intentional in partnering with local organizations like Interact for Health, that does the training and offers that. One of our greatest partners and most popular is the Calm Caterpillar, if you all haven't seen that, that really talks about regulating emotions and partnerships with that, and also relying on the state resources that DCY has developed early to talk about mental health and those other accessible resources to do that. And I also have to acknowledge that we are in our partnership with Cincinnati Public Schools. Part of our agreement is any assessment, any IEPs, any services that are offered to students and preschoolers in public schools, that those will equally be offered to those that are in our Cincinnati Preschool Promise Network. Now, as we all know, it's always challenging to navigate that, and the system is not perfect, but school-based healthcare and school-based services are also available to our families as they in the same way that they're available to our public school families as well. And we are seeing a growing need. And so many times we've designed and had a professional development series that really focuses on behaviors, right? To talk really about how it may be different, to talk about behaviors in young Black boys and what our perspective is on that and how we look at that. And that's not exactly what your question is, Caitlin, but I think it is that we have really been intentional in saying, how do we look at what may be an obstacle to learning in a way that is not only culturally competent, but evidence-based and responsive to what we hear from our educators, because they are the experts. And it is our responsibility to make sure they have the resources that they need to deliver on that excellence and expertise.
All right. There's one last question that kind of slipped in here at the end that I want to ask to make sure it gets through. What things are you doing regarding chronic absenteeism?
So that's thank you for that question. We do not have a chronic absenteeism among our population. We are so proud to say that this year our attendance rate is almost at 89%. Right? Really happy about that. That is thanks to the dedication of our educators and providers being flexible in their network. So we want to continue that, but it is not something that we've done a deep down focus on because the rates are so high and going up kind of a point every year.
Perfect.
Thank you all for the opportunity. Our team is always available. Visit our new redesigned website. I will put the link here, and please reach out anytime. We love to talk about the work that we do and partner with you and know about what you're doing as well.
Perfect. Thank you again, Chara. Thank you everyone who joined us today, and we look forward to reconvening next Thursday.
Thanks, everyone.